Good morning, teacher and students. My name is Jennifer Almeida, and I'm going to talk about long-term outcomes of partial oral treatment of endocarditis. First, we have the definition. Endocarditis is a rare and potentially fatal infection of the inner lining of the heart, the endocardium. It's most commonly caused by bacteria entering the blood and traveling to the heart. Although the heart is usually well protected against infection, it may be easier for bacteria to bypass the immune system in people who have an artificial heart valve, congenital heart disease, hypertrophic cardiomyopathy, and others.
Bacterial endocarditis is an infection of the inner lining of the heart, or endocardium. The native heart valves are common sites for bacteria to infect, but non-valvular areas are also susceptible to infection as well, such as implantable devices or prosthetic valves. The infection usually starts when bacteria enters the bloodstream, then subsequently attaches to the endocardium. Some people at risk for infection are those who have pre-existing heart disease, such as in people with extensive cardiac surgery, people with a history of mitral valve prolapse, or in people with congenital heart diseases. People will present commonly with fever. They may have a new murmur, and even cutaneous manifestations on the skin of their hands and feet. A neat way to remember the common signs and symptoms of infective endocarditis is to remember the phrase from Jane, where F stands for fever and is the most common finding. R stands for Roth spots, which are these white lesions surrounded by hemorrhage on a fundoscopic exam. O stands for Osler nodes, which are these painful immune complex depositions on the pads of their fingers or toes. M stands for a new cardiac murmur. J stands for Janeway lesions, which are these painless lesions on the palm or sole. A is for anemia. N is for nail bed hemorrhages, also known as splinter hemorrhages. E is for emboli, because these patients are at risk for developing septic arterial and pulmonary emboli as a result of the infection. Your patient may not have all these signs and symptoms, but it's helpful to group these ones together because they're often a favorite on exams and many standardized tests. So there you have it, a quick overview of the signs and symptoms of infective endocarditis. If you liked this video and found it helpful, make sure to give it a thumbs up. This helps this video rate higher on YouTube, making it visible to more people and students. And if you haven't done so already, make sure to subscribe, hit that notification bell, so we could tell you when we release more videos like this one.
Next, we have applications in medicine. Remember, patients with infective endocarditis on the left side of the heart are typically treated with intravenous antibiotic agents for up to 6 weeks. Infective endocarditis is confirmed when organisms are identified on histologic examination of endocardial vegetations obtained during cardiac surgery, embolectomy, or autopsy. Since it's not usually possible to obtain vegetations for examination, several clinical criteria have been developed to establish a diagnosis.
Bacterial endocarditis is an infection of the lining of the heart and often involves heart valves. The infection usually starts when bacteria enters the bloodstream and then subsequently attaches to the endocardium. But keep in mind that not all bacteria entering the bloodstream are capable of causing endocarditis, and not all valves are infected equally. Regardless, the diagnosis of endocarditis is often made by culturing one of these bacteria from the blood, sometimes in combination with direct visualization on a cardiac echo. But on your exams and other standardized tests, we love testing your ability to associate historical findings with common bacteria that cause endocarditis in those settings. A lot of this is trivial. But to keep this list organized in your mind, let's divide these trivial clues into heart valves and historical hints. The mitral valve is most often involved. So if you were to come across a situation or test question that's not providing you any specific clues and is asking what heart valve is most likely involved, the mitral valve would be my best educated guess. Test makers love testing endocarditis and the tricuspid valve. The thing to remember here is that it's common to see tricuspid valve endocarditis in intravenous drug users, with common bugs being Staph aureus, Pseudomonas, and Candida. For your historical hints, there are 3 main categories: acute onset, gradual onset, and a basket of miscellaneous medical historical clues. In cases of rapid onset of symptoms, especially in patients with normal heart valves, Staph aureus is a common cause, along with Hassic organisms, which are also known to affect native heart valves. These are Haemophilus, Aggregatibacter, Cardiobacterium, Eikenella, and Kingella. In cases that are more gradual in onset or subacute, especially in the setting of dental procedures, think about Virden strep. In patients with a history of colon cancer, think Strep bovis. In patients with prosthetic heart valves, think Staph epidermidis. Because part of the diagnosis requires culturing these bugs, obtaining multiple blood cultures plays an important role in making the diagnosis. But in cases you still suspect endocarditis when cultures are unrevealing or negative, you should start thinking about Coxiella and Bartonella species. So there you have it, a quick overview of the microbiology of infective endocarditis. If you liked this video and found it helpful, make sure to give it a thumbs up. This helps this video rate higher on YouTube, making it visible to more people and students. And if you haven't done so already, make sure to subscribe, hit that notification bell, so we could tell you when we release more videos like this one.
Patients who receive oral treatment had less comorbidity than intravenous treatments. It improved the agility of the medical system, which today is over its limit, with cases of SARS-CoV, allowing patients to have a controlled outpatient treatment and reduce their exposure. Outpatient follow-up of patients with infective endocarditis and oral antibiotic therapy reduces the physical, psychological, and economic burden on physicians, patients, and their families.
Patients with infective endocarditis on the left side of the heart are typically treated with intravenous antibiotic agents for up to 6 weeks. During the initial phase of hospitalization and treatment, patients often require intensive care and close monitoring. After this period, many patients remain hospitalized to complete intravenous antibiotic treatment. In this randomized non-inferiority trial, 400 adults in stable condition who had endocarditis on the left side of the heart caused by Streptococcus, Enterococcus faecalis, Staphylococcus aureus, or coagulase-negative staphylococci, and who were being treated with intravenous antibiotics were randomized to continue intravenous treatment or to switch to oral antibiotic treatment. In all patients, antibiotic treatment was administered intravenously for at least 10 days. The primary outcome was a composite of all-cause mortality, unplanned cardiac surgery, embolic events, or relapse of bacteremia with the primary pathogen, from the time of randomization until 6 months after antibiotic treatment was completed. In the intravenously treated group, the primary outcome occurred in 24 patients, as compared with 18 patients in the orally treated group, with a between-group difference of 3.1 percentage points that met non-inferiority criteria. This trial showed that in medically stable patients who had endocarditis on the left side of the heart, caused by Streptococcus, E. faecalis, S. aureus, or coagulase-negative staphylococci, a transition from intravenously administered to orally administered antibiotics was non-inferior to continued intravenous antibiotic therapy. Full trial results are available at nejm.org.
In the case of pros and cons, in pros, oral treatment allows to reduce hospital stay and cost. Oral antibiotic therapy can also minimize the complications associated with outpatient parenteral treatment, such as logistics, complications associated with intravenous catheter, and others. Partial oral antibiotic treatment is as effective as complete intravenous treatment, as long as we are dealing with a patient with left body infective endocarditis, due to any of the aforementioned germs, stable, and with adequate gastrointestinal absorption. In cons, prolonged hospital stays are associated with a greater psychological and physical burden compared to shorter length of stay, although there are different observational studies of endocarditis which present the efficacy and safety of switching from intravenous to oral treatment. They have some limitations, such as sample size, strict inclusion criteria, geographic antibiotic resistance, or lack of standardization in oral treatment times. Despite the fact that it is safe and feasible to complete the treatment of highly complex endocarditis with oral treatments, many patients should be closely monitored because the readmission rate is high. Issue applied in Ecuador. Oral antibiotic therapy against bacterial endocarditis in Ecuador has a recent registration in 2019 in a degree thesis in which the disease of several patients was treated at the General Hospital of Puyo, where postoperative states were treated with oral antibiotic therapy. Antibiotic therapy should be instituted due to the realization of blood cultures and antibiogram, since it is important to know the causative agent of the pathology. And finally, we have the conclusion. In patients in a stabilized condition who had infective endocarditis on the left side of the heart, a change from intravenous antibiotic treatment to early oral antibiotic treatment was not associated with delayed treatment failure. Long-term oral antibiotic treatment gives us a certain advantage in terms of the burden that a medical center can receive, since its outpatient management will allow us to have greater fluidity in patient care, but at the same time, its disadvantage is that it allows for quick results as in intravenous treatment, and it's necessary to have a very regular checkup to see that the patient does not develop comorbidities. And that's all. Thank you for watching the video. Have a good day.